right now for sure. Well, thanks everybody for joining us. So Chambers of Commerce, throughout history, they've served as connectors in communities. The Montgomery County Chamber of Commerce is proud of our relationship with Montgomery Regional Tourism, Downtown Christiansburg Incorporated, Downtown Blacksburg Incorporated, the towns of Blacksburg and Christiansburg, Montgomery County, the Office of Economic Development at Virginia Tech, and Virginia Tech Corporate Research Center. As a group, they've been meeting for 2 weeks to examine the impacts of COVID-19 and provide resources the community needs to support our local economy. Our community has proven time and time again that we're resilient and we know how to work together to weather challenges. Each time is different, and each time we learn, we adapt, and we persevere. I hope you saw the Chamber's all-encompassing #MyFootprint campaign, which was launched this week. The intention of this buy local initiative is to create awareness of the businesses in our communities and the importance of buying locally. Locally means purchasing from companies right here in our community, especially now. Thank you to our sponsor of what would have been a different Eggs and Issues today, ServPro, Quinn Mongan, owner of the local franchise, and John Tuttle, Business Development Manager for our community. Your support of the program of work for this chamber is very much appreciated. I also want to thank Erin Harris-Kirby, the current chamber president, for her leadership of our board and chamber during this unprecedented time. Now, it's important to point out, I'm going to go off script because I want to provide a special thanks to Sharon Scott and the team of the chamber. They've been working tirelessly the past several weeks to share information and access resources with the best interest of our community in mind. My name is Kevin Byrd, and I'm the Executive Director of the Middle Valley Regional Commission. I'm also a Chamber Board member, and I'll be serving as moderator for our session this morning. In order to limit background noise, we have all of our attendees on mute. We'll have each of our speakers share their information and plan to have Q&A following their remarks. You can submit your questions via the Zoom chat feature, which should be at the bottom of your toolbar there. Today demonstrates our community working together at its finest. We understand what it means to collaborate as we navigate the COVID-19 storm. Thank you to our speakers from the health professions, our local economy, and leadership of our towns and county. And thank you to the Chamber Collaborative for your attention to the needs of the business community and residents. Again, thank you to our sponsor, ServPro. We wish you could make COVID-19 like it never even happened. I encourage you to visit the Chamber's website and Facebook page to learn more about programming for businesses. Our next Eggs and Issues will be held on May 7th, and our topic will be tourism. The time will be 8 a.m. to 9 a.m., and Zoom details will be forthcoming. So the first speaker on our agenda today is Dr. Noelle Bissell. She's the director of the Neuro Health District, and it looks like I'm getting a call from her right now. So might need to coordinate with her in just a moment if she's not on the Zoom call. Let's see. Does anybody know if Dr. Bissell is on the line? I will coordinate with her in just a moment. I don't know if we're able to rearrange our speakers and go to our next folks, which is Anthony Grafsky. He's the Senior Director of Clinical Operations at Carilion Clinic, and Stephen Chandler. He's the Chief Operating Officer at LewisGale Montgomery. And they'll be co-presenting, which is another demonstration of great collaboration that's taking place in our region. So we're able to pivot and have their presentation available. Great. So hopefully Anthony and Stephen, you guys are ready for us. And I'll see what I can do about connecting with Dr. Bissell here.
All right, can everybody hear me? This is Anthony. Good, okay. Stephen, are you off mute yet?
Hey, this is Noelle. I was able to get on.
Great. Well, Dr. Bissell, let's go ahead and pivot back to you first. I think you have a lot of really good framing information, and then Stephen and Anthony can follow you and talk about the local hospitals. So we'll go ahead and give the floor to you. Thank you, Noelle.
Thank you. Sorry, I had a problem getting connected. So yeah, just talking about COVID and our response. First of all, reminding people that pandemics are going to be inevitable because of global travel, and how quickly they spread and how bad they are is going to depend on where they start, as far as how much travel is coming to and from that area, how virulent they are, and then their transmissibility. We do know that pretty much every infection is going to have a period where they're asymptomatic spread. And with the flu, for instance, we know it's about 24 hours. With this particular infection, we're thinking it's a little bit longer, perhaps 48 hours, which makes it really hard to track it. We're trying to keep the message framed around kind of the best way to deal with any of these things is those personal protective measures and that personal responsibility for infection prevention and control. Simple things like social distancing, not being too close, washing your hands, not touching your face, disinfecting things. Those kinds of things have been shown to prevent the spread of disease. And in fact, in this pandemic, areas that have instituted those things are starting to see that flattening of the curve, which is kind of spreading out the infection so we don't overwhelm our resources. Obviously, resources are limited, and that's what kind of got the whole Montgomery County task force going, was trying to protect our healthcare infrastructure, and also protecting our first responders, our local EMS, our law enforcement, and then also looking into protecting our most vulnerable populations, those in the congregate settings, whether it's nursing facilities, mental health facilities, jails, those in homeless shelters and whatnot. So the messaging we're trying to get out there, that we're lucky, is with the COVID-19, 80 to 85% of people are going to recover just fine at home if they just practice, self-care and those good measures of isolating themselves and staying away from other people when they're sick. Those people don't need the medical resources of the emergency department, and certainly not the ICU or the ventilator. So we're trying to get that messaging across. The other thing that's been challenging has been the whole testing thing. Coming down from the federal level and the state level, we hear about how testing is so challenging and we need more testing, But to be honest, we're doing okay with testing. Testing helps us epidemiologically. It helps us kind of see the disease prevalence in our community. It helps us see kind of how it's spread. It helps us look at asymptomatic carriers and whatnot. But on the individual basis, the result of their test is not going to change or inform how we recommend they take care of themselves. So we really have tried to get that message out, and I think we've done a pretty good job controlling that message. We do know that with testing, we don't want it to be at the hospital because we don't want to overwhelm those resources. So we did develop a model that's been used in other states, in other countries, that has worked quite well, and that's the drive-through. We've been doing that for over a week now. We've tested several hundred people. As expected, most of our tests are coming back negative, but also as expected, we are seeing more positives. So it's not unexpected. We technically have hit community spread in this area, but we knew we had disease, and it was just a matter of detecting it and tracking it. Along the lines of protecting our first responders, now we know we have community spread. Everyone is treating it like we have community spread. They need to be highly suspicious of it when they're dealing with the public, our EMS folks when they're doing a run, our hospital folks when they have someone come into the hospital, and our law enforcement when they get a call. They have to be aware of that, so people are masking and following good precautions, wearing personal protective equipment. We're also working to get a rapid diagnosis tool in addition to some antibody tests so that we can best determine who's been exposed, who has the infection, and best advise them on how to proceed, because we still need those resources. We still need people who can answer those 911 calls. We still need people in the hospital to take care of those really sick people. And so we're working on a way right now, and I think it's going quite well, to use the testing availability we have and make the best judgment on how we go with our first responders, our healthcare workers. And people need to realize that a test is one point in time. And we have to look at the whole spectrum, from infection to symptoms to course of illness, and then use that to guide our response. So I think the task force has been great. We're working together, we're preparing, and we're using all of our resources to be very proactive. And that's key, is a proactive and a preparedness approach versus reactive and kind of catching up. So that's kind of where we're coming from on the public health side.
Dr. Bissell, can you speak a little bit about the task force and how that has been going the past several weeks?
So the task force was started by Montgomery County leadership, town of Blacksburg, town of Christiansburg, and then they invited a bunch of us, including public health, our hospital systems, our schools, our community services. So it's law enforcement, EMS, first responders, community services, you know, pretty much all of the big community players. And the nice thing is that everyone's together communicating, and everyone brings their level of expertise to dealing with this. I think that's really important, because sometimes community organizations tend to be somewhat siloed. They get focused on doing their own thing, and they kind of forget about what everyone else has to offer. And like doing the drive-through testing, there would have been no way that we could have done that, just the health department pulling that off. But everyone provided logistics. Everyone has provided a different step in there. And then we literally come in and do the medical part and the testing part and provide the guidance. And it's been very seamless. It's not like those ones you see on TV where it's chaos and there are lines of hours and hours and hours and people are frustrated and upset. It's gone very well. And I think it's provided a valuable community service. We talk about, do we need to do feeding? We talk about our congregate populations that we really need to watch out for. And everyone brings their expertise to the table and communicates and collaborates. And that's key in a response like this.
Maybe a two-part follow-up here. How long do you think that the drive-through testing is going to be available? And do you think that we're going to need to have mass testing before our communities feel safe going back to regular routines?
So I think, you know, now that we've kind of documented, we have community spread, we've kind of seen where it is. I think our focus now can be less on community testing. People are listening to the guidance. People are hearing, you need to stay home. So now we need to focus on our first responders, our healthcare workers, and making sure that as we see more and more cases coming into the medical system, that those folks are prepared to take care of them. And we'll continue to do some community testing, and we'll probably do what we call kind of a pulse testing, where we focus a little bit more and see what's happening in our hospitals. Our hospitals are not at surge capacity right now. They're not being overwhelmed, but we do expect them to see more cases. As we do that, we may kind of do, some pulse testing out in the community to see where we are. But we have not seen an overwhelming charge for testing. We are having people call through the call center. They're getting screened. A lot of them just have questions and are, wanting some answers about what they can do and how they can kind of function in this. And I think it's appropriate. So we may actually go down a little bit with community testing and then do some pulse checks.
Great. Well, Dr. Bissell, we appreciate your leadership. So others on our call today are aware, the Regional Commission hosts a conference call Monday, Wednesday, Friday afternoon with our local government managers, and Dr. Bissell joins that conversation because all these local governments are supporting and trying to figure out the right policies and actions to take, and Dr. Bissell's advisement has been critical each step of the way, and just really appreciate your participation and leadership throughout all of this.
And that's a big important thing, Kevin, is it started with Montgomery County, but we realized it's regional and all of our localities have provided resources. Everybody has chipped in and realized that this is a community, a district, a New River Valley effort, and that's really important.
Very good. Well, thank you for joining us. I hope you can stay along with us perhaps in case there's other follow-up pieces, but if you have to run, I certainly understand.
Well, I'm going to stay and I may check in and out because I have another important meeting.
Great. Thank you so much for joining us. Next up on our agenda, we have Anthony and Stephen. Anthony is with Carilion Clinic and Stephen is with LewisGale Montgomery, and they have a presentation. They're going to share some slides with us. I'll let Chamber pull that up for us.
And while that's being done, this is Stephen Chandler. I just want to say how lucky and fortunate we should all be to have somebody like Dr. Noelle Bissell leading our public health department. She has been an absolutely invaluable resource to, I think, both of our hospitals, and has provided really some fantastic leadership to us about how do we respond as a community to ensure that we stop the spread, and if it does spread, that we're ready for it. So just want to echo that sentiment and say thank you very much. We sincerely appreciate it at the hospitals.
And I would echo everything Stephen just said there.
Yeah. All right, Anthony, all yours.
All right. Well, we're gonna go through a handful of slides here, and Stephen and I are gonna tag team this. I'm gonna take the first couple. If we want to go ahead and go to the next slide, this should be one that everybody's intimately familiar with by now. This is Johns Hopkins Coronavirus Resource Center. So this is a snapshot from 1 o'clock yesterday afternoon, and so you can see we had, about 403,000 total cases in the United States. As of about 7 a.m. this morning, that was at 432,000. We're approaching 15,000 deaths. If you zoom down into Virginia, so far we're at about 3,650 cases in the state. And to Dr. Bissell's point, we've tested a lot of people. We've tested over 31,000 people throughout the state, and so just over 10% of those are coming back with positive results, coronavirus positive. I think one thing to focus in on, so in the bottom right-hand corner, you can see kind of that curve that ramps up in terms of the number of confirmed cases that we've had across the country. But if you plot that on the logarithmic scale, which is the next one, you start to see that while we're still incrementally adding a lot of cases every day, it's starting to flatten out. So we're not getting that exponential growth day over day that we've been seeing. So that means that what we're doing is working, staying at home, masking, washing your hands, doing all the responsible things that we're supposed to be doing, like Dr. Bissell said, is really helping. And that's going to play out in a couple of slides here when Stephen starts to talk about the peak and what we're anticipating there. All right. If we go to the next slide, we'll zoom in on Montgomery County, and you'll notice that we didn't have our first case, at least confirmed case, here in the county until the end of March. But in the last week, we've identified 15 more, or had 15 more tests come back positive. So on a small scale, we've seen exponential growth in the number of tests, and it's not that we didn't think we had it here. We knew it was here, but what this shows is, or at least how this drives our reactions, is that there's evidence of community spread. It's not just isolated to one person or a small group of folks. It's starting to spread throughout the community, and that just drives the need to be even more cautious and even more aware of what you're doing, where you're going, keeping yourself clean, keeping folks safe. And to Dr. Bissell's point of protecting the front line, that's driven a lot of the reaction here within Carilion Clinic. I'm sure it's doing the same thing at HCA for Stephen, and we'll talk about kind of our reaction, how we've been reacting, and the evolution of that towards the end of the presentation. All right. So now turn it over to Stephen.
Okay, thanks. So just as a brief introduction about the next couple of slides that we talk about, surge planning and the hospital's response. I think Dwight Eisenhower said, plans are worthless, but planning is essential. Or put another way, I think Mike Tyson said, everyone's got a plan until they get punched in the face. And that, I think, is a charge for what the hospitals have been focused on. As Dr. Bissell mentioned, the hospitals are not in surge capacity yet, but we need to be prepared for it. That we owe that to the community. You rely on us to be that safe haven and safety net for the community. So we, both of our institutions, take that very seriously. One of the key pieces about aligning resources to effectively deal with a mass volume event of patients is figuring out when exactly we're going to need those resources. And so both of our institutions are doing a lot of trying to understand what the timeline looks like. And this is a chart nationally from Axios that was from about 3 weeks ago that showed the projected date of peak for each one of the states. And as you can see, Virginia was really one of the last states that was projected to peak. And that would have been in mid to late May at that point. And we certainly assumed that the peak for our community would be around the same time, given that we just, over the last couple of days, have verified a community spread in the area. If you could go to the next slide, please. This is more of an updated timeline from some publicly reported data. And you can see I think the key message on this one is that the curve for the peak has shifted to the left and become earlier. On this particular slide, it shows the peak being in mid-April, so in about a week and a half or 2 weeks. This is for the state of Virginia. The shaded area is what is also helpful. This is the scale or the band for 95% confidence, and it can go way down, or as you can see, it can go way up to overwhelming hospital resources and community resources to assist. Basically, what this is showing at this point is that the state of Virginia has just the right amount of beds in order to deal with the surge that's planning, because of all the things that Dr. Bissell described of social distancing, hand washing, and community response has been working. The other piece of that, and what really matters to the hospitals, is critical care capacity, because as a respiratory disease, a lot of these individuals are on ventilators and they're incredibly sick, and they get sick very fast. And so our efforts in terms of surge planning have been revolving around inpatient capacity, not necessarily emergency department capacity, to ensure that we can continue to care for those patients. So if you could go to the next slide, please. This next slide kind of shows the difference. It basically takes what we initially thought 3 weeks ago, which would be the red shaded peak graph, versus what we're anticipating now, which is the blue graph. So you can see that the peak is much smaller, and the disease progression is on a shorter time frame, and the peak happens probably about a month earlier than what we anticipated. Now, this is just a snapshot in time. These timelines and peak projections change almost on a daily basis, but this is kind of the best information that we know now. So based on, we know that in the next 2 weeks or so, whatever the peak may be for our community is upcoming. How do we prepare for that? And so if you can go to the next slide, this is a slide that Anthony and I are going to jointly present, is what the hospital focus looks like for what that peak is. I think first and foremost on the surge planning is caregiver safety. We're constantly drilling and working with our nurses and techs and respiratory therapists and physicians on ensuring that they are safe. One of the things that we've done as an example at LewisGale Montgomery is created a telehealth option for emergency department physicians and hospitalist physicians, where we take an iPad into the room and they can do a virtual consult at the nurse's station to talk to a patient to ensure that we're limiting the amount of people that are actually going into a patient room. Again, that protection of our caregivers is of utmost importance for us. So I'm sure Anthony's got some comments on that as well.
Yeah, definitely. You know, I think the important thing here, and it's evident in those slides that Stephen was just going through, is that, you know, I think you can deduce that the state reacted pretty quickly, or really not reacted, but was proactive in the actions that they took to kind of combat the spread of this disease. And while we've got some hot spots throughout the state, you know, overall that shifting of that curve really is a testament to the work that's gone on. Some of the things that we've done here is we've created a lot of negative pressure isolation space and worked to cohort any patients that are coming into the hospital that we are testing for coronavirus. And so, you know, what we're doing is we're cohorting those patients. We are limiting, just like Stephen said, the number of providers that are going into those spaces, so as to limit exposures across the hospital, across the units, and so that, you know, that's been one thing. And then I'm sure, as Stephen's and all of HCA is doing, is, you know, adjusting or flexing how we are physically protecting our staff, whether it's with masks or respirators or disposable scrubs, you know, what have you. And so you've got to be real fluid with that, as the recommendations from the CDC, from the state, continue to evolve as we better understand the virology of this disease.
Yeah, and you know, as we go to the middle section about partnerships, I think Dr. Bissell described this really well. That there has been such overwhelming support of our hospitals in response to the COVID situation, and understanding that the hospitals are an absolutely critical resource to care for the sickest patients whenever they need it. And this is just a list that's certainly not comprehensive of everybody who has come together and supported that critical infrastructure for us to be successful. And I think Dr. Bissell went through some of the specifics of each one of those. And you know, it's even local businesses that have asked if they could, you know, pay for lunch for the entire hospital, and that has been done on several occasions over the last 2 weeks. I think, you know, healthcare employees are ones to never turn away free food, and that has been such a comfort and a joy, and something that we've really appreciated.
Yeah, definitely. I have not gone hungry during this situation. Yeah, we've just been overwhelmed and totally blown away by the support of the community and the collaboration. You know, Stephen, I know you've been very involved in the task force that Dr. Bissell was talking about earlier. But you know, we've been really fortunate. We've had a couple of groups from Virginia Tech engineering departments come through here, offering, you know, designs for PPE, personal protective equipment. We're working with them, and you know, taking that, we've set up donation centers. The Carilion Clinic as a whole has set up donation centers across our service area, and we've just had an outpouring of support there. You know, folks just, hey, can I make you a mask? Can I do this? Can I do that? We've had, to Stephen's point, donations coming in. Buy the staff food, and please support local businesses. Like, here's money. I want you to buy from this list of local businesses. You know, feed your folks, take care of them. So yeah, thank you to the community. It definitely is a testament to the strength of this community.
Absolutely. And that final piece in terms of testing, you know, we have at both of our facilities have been prioritizing inpatient testing, because the test results make a difference in how we care for those particular patients. And given, when this first started, oftentimes hospitals were waiting 6 to 8 days for a test result to come back, and that's a long time to wait to start, appropriate treatment. And there's certainly some things you can do proactively and prophylactically, but the timely results have been really important. And so, outpatient or third-party labs like LabCorp and Quest for both of our facilities have really stepped up, and in terms of prioritizing tests for inpatients and for healthcare workers, that timeline has been cut down substantially. For us, we can get inpatient results back within a matter of hours, and for healthcare workers, we can get those back within a matter of 48 hours to get those folks back in the game and supporting it. And then, Dr. Bissell, described, really the importance of the community coming together to do off-site testing. That matters a great deal for the epidemiological perspective of the disease, but in helping take some of the pressure off of the hospital to have to own the outpatient testing piece has been so overwhelmingly beneficial to us to ensure that that we're ready for any sort of surge.
Yeah, and the majority of our testing, or the majority of the folks that we've tested, we're sending home, because to the earlier point, 80 to 85% of these folks that do test positive can recover, very safely at home, practicing safe social distancing and that. So, yeah, the vast majority of our folks, they come in, we test them, and because their symptoms are mild, or they're stratified to a low risk group, we're sending them back home. We have anywhere from 5 to 10 patients on any given day sitting in the hospital awaiting results. And like Stephen, we've seen over the last probably 10 days that turnaround time on test results really come down. At one point, we were waiting 11 days on a couple of outstanding tests and having to chase those down. But yeah, we're getting results now within 48 to 72 hours.
Well, Kevin, that is it for us. Happy to answer any follow-up questions or wait for the Q&A until afterwards.
Great. Well, thanks both of you guys for joining us this morning, and thanks to everything that you're doing at both the hospitals. As a reminder, you have that chat feature at the bottom of your Zoom toolbar. Feel free to submit some questions as we're going along as well. Our next section of speakers are representatives of our local governments, and they have been in some unprecedented times as well, because so much of the work that they do involves engagement with the public. And you can imagine what the challenges that presents right now. But for our local government section, first we'll have Steve Fijalkowski. He's the chair of the Montgomery County Board of Supervisors. And after Steve, we'll be joined by Marc Verneil, the Blacksburg town manager. And following Marc, we'll have Mayor Barber and Randy Wingfield from Christiansburg. So Steve, we'll turn it over to you. And Steve's still on mute. Let's see if we can't get him off mute. There you go, Steve.
Okay, can you hear me now?
We got you.
All right, thank you, Kevin. You probably noticed, Kevin, I think the last time we met, I wasn't able to use Zoom, but apparently I can from my home, so we're going to give it a try today. First of all, I want to start out by saying that Craig Meadows, our county administrator, apologizes for not being able to be here. He had a prior appointment today, and is not able to make it. But just kind of a brief rundown of what the county is dealing with and has been dealing with. On March the 20th, our government center was closed to the public. Our county administrator worked that out with his counterparts at Blacksburg and Christiansburg as the cases started to come into Montgomery County. We knew we had to take some kind of action to protect our employees in the government center. But then on April 6th, the government center was closed to our employees after an exposure to COVID-19. And we had one of our employees test positive. And this, thanks to Dr. Bissell and her recommendation, we decided to go ahead and close the government center for 2 weeks. It's some good news on that, though, is that the initial employee that tested positive, the second test came back negative. So that's a good sign. But we had many more that were tested, and as of yesterday afternoon, I haven't heard if their results are back yet. But, so at any rate, we are in the process of contracting to do a complete disinfection of the whole facility. We also have an emergency plan, and we have instituted that so that essential functions of government will continue. Our employees will continue to get paid. Many of our departments are operating either from home or alternate sites, and we are continuing with the mission of government. Michael Geary has been working with the task force and also coordinating with all the other agencies to keep us informed on all the new developments. He has also accepted the full-time position of Emergency Services Coordinator, which has taken on a whole new meaning in the light of this pandemic. And we appreciate all his hard work. The county updates its website with information on the COVID-19 pandemic. And that website is montva.com/coronavirus, but I'm sure you all can find that. Many of our county employees are still working from home to keep the department operations moving forward. And I just give you an example. Our planning and GIS services can be contacted through the office phone number if you need to submit a new site plan, or if you need to reach them by email, you can do that also. If you need to meet with the development review team to discuss an application, you can use the pre-submittal online form, and a time and date will be set for a virtual meeting. This has all been arranged just so that we can, we've had a lot of growth in the county in the past year, and we know that's going to continue. And so we want to keep that moving. So I'm glad to see that department's got a plan. Brian Hamilton and our economic development folks have been meeting with businesses to discuss access to grants. And this is being done virtually as well. The census continues to move forward during this time as best as it can through virtual means. We all need to encourage all our citizens to participate in this very important effort. Of all years for the census to fall, it has to fall on a year where we have a pandemic, which definitely hampers things, but it is very important we get an accurate count. The Board of Supervisors has been meeting electronically for the last 2 meetings, and will meet on the 13th by video conferencing. We will be voting on the tax rate and budget for 2021. The county is in better position as it does not rely heavily on meals and lodging taxes, and can make adjustments in spending as conditions dictate. We will also be considering allocating $300,000 for COVID-19 expenditures and waiving penalties and interest on tax bills due in June. This will be set up for 90 days, but also could be extended as the situation changes. Those are just some of the highlights that I could think of. I'll just turn it back over to you, Kevin.
Great, Steve. Thank you so much. And as all these local government bodies are trying to continue business operations, I know you all are still having some board meetings. How do citizens find out about your board meetings, and what platforms are you using?
Well, we every time we have a meeting, we advertise it, of course, in the old traditional ways in newspapers, but we also have it on our website, all that information. And our last meeting was a public meeting, which seems kind of strange that you have a public meeting where the public can't really speak, but they had several ways that the public could send to us their opinions on the budget and the tax rate. And that was done 4 different ways. They could call and leave us a phone message. They could email us. They could, what is some of the other ways here? I can't think right off the bat now what they were, but we announced them at the meeting. And I guess we haven't got that many responses on that. And I think that is a result of the fact that everybody's got something more important to do right now as they're dealing with the pandemic. So
that's right. Well, thank you so much.
I'm not sure if that answered your question.
Yeah, it does. And I know in those conversations with local government managers, they're all being creative and trying to find ways for the public to observe the meetings and provide the feedback, just like you pointed out. Phone calls, emails, social media, however people may choose to do that. I think Montgomery County, I think Craig had mentioned yesterday that you all are looking at YouTube to be able to broadcast meetings on there. And,
yes.
Yeah.
I think some localities are using Facebook, but we use YouTube.
Mm-hmm.
That way you could, after it's done or while it's being, the meeting is going on, you could watch it either live or you could watch it at your convenience. So you'll stay informed.
Great. Thank you, Steve. And next we'll turn to Marc Verneil. See if get you off mute here, Marc. Okay, great. You're ready to roll.
Yeah. Thanks, Kevin. First, I'd like to thank the Chamber for hosting this event today, and then also thank Kevin for facilitating. And he also is the person who pulls all of the local government managers together 3 times a week. All the managers from the entire New River Valley get together and talk and share ideas, and it's been a great collaboration with that group. So thanks, Kevin, for pulling us together. Also, Dr. Bissell and the task force, they've been doing amazing work. And anyone, I've seen them up close and personal. I've been to the testing center, and everyone would be really proud of the way that our entire counties come together, leaders from different sectors of the county coming together to protect and plan for this pandemic. And then also the business community has really been creative. We've been talking to a lot of our businesses here, and there's a lot of creativity on how to stay open, how to keep employees paid, and how to serve the community through this. So there's a lot of folks there that are doing a lot of great things for the community. As we all know, we're all operating under the governor's order, and that's impacted all of our lives. It's impacted our work lives and our home lives. And of course, that's established different types of essential businesses and put restrictions on gatherings in the community. So the local governments have been reacting to that, adjusting our operations, but also having to work to try to enforce those orders. And I will say, from the enforcement standpoint, we haven't had very much to do. The citizens in our county and in our 2 towns have really stepped up, and they are following the guidance that's coming down from both the federal government and the state government, and doing what they're supposed to do. So our police have had to have a few conversations with students, but the students were compliant, very respectful, and did what they were supposed to do very quickly. So that's been going very well. For the town of Blacksburg, just like the other local governments, I think you'll hear a lot of similar things. We've of course organized ourselves to make quick decisions and react as daily changes come as the pandemic evolves. We are still operating most of our services. Our recreation services, of course, are shut down. but that's really about the only thing that's completely shut down. Our town facilities are closed to the public, but we do have people working both remotely, and we have some folks working in the office as well to keep the services going. And then, of course, we have a lot of employees that provide services out in the field. You know, that's Public Works, that's our police department, and then our fire and rescue volunteers that are out providing services in person. So we've done whatever we can to help them practice good social distancing practices while they're working and provide them the gear that they need to be safe. So for the most part, our services are still up and running, but we do probably look a little different. And if you call us, you know, the response times may be a little different just because we're doing things from home in a lot of cases. Blacksburg Transit is still operating. You know, transit is critical to moving people around this community. And frankly, the people that are using transit right now are the ones who don't really have any other options for transportation. So you will see reduced service levels. And we've kind of had to gradually adjust our transit service levels. You know, when the students first came back from the extended 2-week spring break, we really didn't know what to expect. So we put a little bit more service out on the road than we really needed. Now we're able, based on ridership data, to start to roll that back and have that match what our ridership levels are, but also keep enough service on the road so that we're not having buses that have too many people on them. So, but Blacksburg Transit is still running, and the best way to keep up with their schedule is to use their app or go on their social media page to keep up with what they're doing. All of our departments have developed their essential operations plans, and those are in place now to keep things up and running. Like all the businesses, we've had to adjust to new rules for employee leave and Family Medical Leave Act and leave for childcare. We've done that as well. We're providing a lot of flexibility for our employees. We've also, like the county and Christiansburg both have done, we've implemented a meals and lodging tax amnesty program. But essentially, the businesses still file, but there's no late penalty fees and no interest. So those collected revenues can then be paid later. And then we're going to be flexible with the businesses on how that gets done. And I know that's been appreciated by both hotels and restaurants. We've been getting a lot of nice notes from folks as they've been filing. That they're very appreciative of that. So that's been a good thing to do. And like the other localities, we're being flexible with utility billing as well. We've also had to do a lot of coordination with the university. Of course, the university makes decisions and it impacts us all because there's so much of our population. You know, about 2/3 of Blacksburg's population is students, and about 1/3 of the entire county is students. As those decisions are made, impacting the students, they definitely impact the localities and our businesses as well. Our council meetings, we're doing similarly to the county and Christiansburg. We've gone online for the month of April. So we're conducting our meetings over Zoom, and what we're doing is we're broadcasting those on our Channel 2 cable access channel, and we're also broadcasting them on our website through the system that we normally broadcast our meetings online. The budget process is going to be a bit different this year. We're going to follow the same schedule, but there's really no way legally within the Code of Virginia to hold a public hearing electronically. So what we're doing is we've opened up a comment period that started on April 1st. It'll run through, I believe, the 22nd of April, and people can send us comments through a web form, via email. We have a phone number where they can leave a voicemail, and they can also do that via the mail. They can mail comments to us, and then we'll compile all those comments and we'll send those to the council. So the council will have those public comments as they consider the budget. Now, I talked to the council about the budget a couple of times over the last few weeks in work sessions, and our budget was put together in January and February when everything was going great. And of course, first, second week of March, things changed drastically. So what we're doing with our budget, at least at the town of Blacksburg, is we're recommending that the council approve the budget as recommended, and then we're going to have to make adjustments to adjust that budget down based on what the realities are of our revenues. And there's two things we're looking at right now. We're looking at the remainder of the current fiscal year we're in right now, which runs from now until July 1st, and we're going to be impacted negatively with revenues there. But we do have some strategies in place to defer some capital projects, to defer some payments that we essentially internal payments we make to ourselves, to replace vehicles and equipment, and to stop a lot of spending that was planned. We've kind of put on hold. And we've also put a hiring freeze in place. So, but all those different strategies we'll be able to get through the remainder of this year. The next budget year is more of an unknown. We know that Virginia Tech is online now. We know that we're missing the spring game, and we're missing the graduation weekends, which are big weekends for our business community and which also generate revenues for the local governments. And we also know that online classes have gone online for the summer, and they've also moved summer orientation online. So a lot of those folks that would be staying in hotels and visiting our restaurants, and this is, this impacts both Christiansburg, Blacksburg, and the county, aren't going to be here this summer. So we know we're going to have those impacts to deal with. What we don't know is what's going to happen in the fall. And I don't know that anybody knows yet. So we're going to have to plan for scenarios in our budget that look from a best case of things get back to normal in the fall to a worst case of, if there's significant changes at Virginia Tech. So that's what we're doing. We're going to be doing a lot of contingency planning to prepare for that. And just to give everyone a picture of what the impact on the town's budget is, at least, and I'd say the impact is pretty similar for Christiansburg as well. There was an Old Dominion University white paper that came out last week that looked at the physical impacts of the coronavirus on cities, counties, and towns. And towns are the most dependent political subdivisions. They're political subdivisions in Virginia. They're the most dependent on economically sensitive tax revenues. So those are meals, lodging, sales, and business license taxes. Those are all really dependent on a strong economy. So for towns, the average is about 31% of their general fund budgets are dependent on those revenues. For counties, the average is 6 to 7%. For cities, it's 11 to 12%. So you can see towns are affected more by this type of economic crisis than cities or counties are. For the town of Blacksburg, about 34% of our revenues are in those categories. And for the town of Christiansburg, I think Randy and Mayor Barber will probably cover this. It's higher than that for them. And we have the kind of double whammy here of, we have two of the largest towns in the state, both in Montgomery County, that are very dependent on these revenue sources. But we also have, a large state university, which is the economic engine that makes the economy work. So as in past recessions, the university has really been this stabilizer that has, even though we may have had a housing downturn, the university's still been functioning and still been moving forward, and they've been this kind of stabilizing factor in our local economy, which impacts the local business community, and then also therefore impacts what the town and the county's revenues are. In this case, with the pandemic, of course, it's very different because the students aren't here, and they're not going to be here for the summer. So it has a different look and feel to it, and it's going to impact us much more significantly. So that's what we're doing with our budget. So right now there's just kind of a lot of unknowns, and we're going to have to put plans in place for various different scenarios looking forward into the next year. When it comes to land development and construction, I know a lot of folks are interested in that. Land development and construction are still moving forward. The only exception is because there's really no way to hold an electronic public hearing. Any of the projects that would have to go to the Planning Commission or Council are on hold until we can have public hearings again. And we're looking at ways for, once we start to move back towards a more normal schedule, how do we get those things moving quickly so that the projects that are going before the council and the Planning Commission can get started back up again. But on the construction projects that are already approved or site plans that are staff reviews that are already in the process, we are still moving forward on those. We have staff members, some are working from home. They can do those plan reviews working from home. And then we do have our inspectors that are coming in and are doing construction inspections. The board chair mentioned the census. The census, again, is very important. That the census impacts funding for our localities going for the next decade. So it's important to get that right. And as he mentioned, the pandemic couldn't have come at a worse time. And the fact that the Virginia Tech students aren't here doubly impacts that. The students are typically a group that is undercounted in the census nationwide. So that's typical now, and with them not actually being physically here, it's more of a challenge to get them to fill out their census forms here. Now, we've been working very actively with Virginia Tech and their communications folks to communicate to the students and to parents to make sure that the students do know that they are to be counted here in Blacksburg, Christiansburg, and Montgomery County, where they reside most of the year. So there's been a pretty robust communication effort going on there, but we do still expect that we're going to have some issues with that census count, and we'll be working with the Census Bureau to try to remedy that. So that's a kind of a quick summary of what we're doing here. And I know that Randy and Mayor Barber will tell you what's going on in the town of Christiansburg, and I think you'll hear a lot of similar things from the town of Christiansburg. We are communicating very frequently. As I said, Kevin's pulling us together 3 days a week, and then Randy and Craig Meadows and I are talking even more frequently than that, just to make sure that the local governments are coordinating here, and we kind of keep our finger on the pulse of what's going on in the community.
Marc, thanks so much. Appreciate everything that you're doing, keeping things rolling in town. We did have a question come through a minute ago, and I think you're probably the most appropriate person to respond to it. It was a question about Virginia Tech and any decisions that they're making as it greatly impacts those sensitive taxes that you just talked about. And I think this is coming mostly from the lodging perspective. You know, to what degree is the town of Blacksburg or other health folks within our communities involved with those decisions at Virginia Tech, whether they're going to have students come back and when that might look like?
Well, we're in constant communication with the leadership at Tech, and what we're doing is making them aware of how their decisions impact the wider community. Just so that's another data point they have as they make decisions. I know that Dr. Bissell has also communicated with them from a public health perspective, and they've been also communicating with the hospitals. So they've been communicating with public health officials and also with the local governments. And I think our role as Virginia Tech makes these decisions is just to make sure that they have full information and understand what the impacts of their decisions will be. So that's what I've been trying to do. And you know, if any businesses have concerns about those decisions, I'm happy to pass those along. And you know, I have been passing along kind of the cycle for how things work here in our county. And a lot of the businesses are dependent on the cycle of Virginia Tech, especially restaurants and lodging businesses. And of course, from spring break to graduation is a big period for those hospitality businesses. Typically, you have the spring game and graduation. The summer slows down, but you really count on that orientation business and some of the students that are still here. And then the fall is really when you're filling your storehouse to get through the rest of the year. The fall is typically football season. That's the busiest period of the year for a lot of businesses in the county. And then that helps them get through the winter, the slow months of December, January, February, and then the first part of March. So we've communicated all that to Virginia Tech just so they know how all that works and know how those can factor those into their decisions. But at the end of the day, I think they're going to have to make decisions based on good, solid science and public health information. And hopefully that's what they'll continue to do.
Great. Thanks so much, Marc. Well, let's turn to Mayor Barber and Randy in Christiansburg. Let's see. Randy on video's on mute still, and then There we go. Okay, you guys, look at you have a presentation. Very good.
I guess you can see the screen, I'm assuming.
Yes, we have it.
Okay. I guess I'll just start by referencing the numbers that Marc mentioned. He had mentioned BPOL tax, sales tax, also, guess meals and lodging, and those figures for Christiansburg for BPOL accounts for basically 2.5 million or 8.8% of our budget. Sales tax accounts for 1.9 million or 6.8% of our budget. Lodging tax is 5.9% of our budget, or approximately 1.6 million. And meals tax is around 7 million. It's about 24.9% of our budget. If you add all of those together, that's 46.3% of our budget. So just to give you an idea of the effect on us. And that's basically from the same study that Marc referenced.
Randy, okay, I just want to see, are you controlling the presentation on your end, or is that?
I think I am.
You've
I'll
got
give
it.
you just a little overview of what we're going to talk about our declaration of local emergency, the Montgomery County Public Health Task Force, town council initiatives, including measures for hospitality businesses and also temporary measures for water, sewer, and stormwater services. Resource and outreach, which includes the COVID-19 website page on our homepage, a restaurant operations website page on our homepage, reach out through the Small Business Development Center in a webinar we hosted, and also email outreach. Declaration of local emergency on March 17th at 7 p.m. The town of Christiansburg and Montgomery County issued a joint declaration of local emergency due to the spread of COVID-19. Fire Chief Billy Hanks assumed the position of Emergency Services Coordinator on a full-time basis. And the declaration of local emergency enables us to receive FEMA and state disaster funding. Although, of course, you have to meet certain criteria and you have to have extensive documentation. The County Public Health Task Force was formed on March 11th. Members include Near Valley Health District, Virginia Department of Health. Dr. Bissell has been great. I think that's been mentioned, but she certainly has. Town of Blacksburg, Town of Christiansburg, Montgomery County, first responder agencies, police, fire, and rescue, Near Valley Community Services, local medical officials, educational officials, and I'll just say it's great to have good partners in trying times, and they certainly all have been. I don't know, like I say, what you wouldn't do without good partners, to be honest. The task force stays connected through daily meetings. They organize and continue to host drive-through testing sites. Testing sites active today at Blacksburg High School, I believe. At least I know it was yesterday. And they continue to push out regular updates and information to the community. Some of the temporary, well, I'll let the mayor deal with some of the temporary measures for businesses. Mayor? His mic isn't live. I guess I'll go ahead and talk. Some of the temporary measures for hospitality businesses include basically for increasing the discount for timely payment from 3% to 10% for March, April, and May for meals and lodging tax. Also, we did set our penalties and interest for 0% for these months, so that the local hospitality businesses could basically pay without penalty. Hopefully that can help them make it through this. Any type of help they can get, they probably need it at this time. I guess similar in regards to water and sewer and stormwater service fees. The April, May water, stormwater fees basically can be paid within 90 days with 0% penalty, 0% interest. Some things we've done in regards to resources and outreach. We continue to coordinate public messaging with the Montgomery County Public Health Task Force. We set up our COVID-19 resource page at www.christiansburg.org/COVID-19. And on that page, you'll find information regarding town operations. We were operating fairly similar to the way Marc mentioned for Blacksburg. Town hall is closed, although we have had a couple of public meetings since then. The first town council meeting that we had, we did it as a public meeting. We basically did 6-foot separation. We only had 2 citizens attend, so you know, it was fairly lightly attended. The second meeting we had was a budget work session on Tuesday. I think that went pretty well. We did that completely remotely via Zoom, and we broadcast it on Facebook Live. Some of the other information we have on the site includes information for businesses and residents, information from the CDC, helpful information including updates from Montgomery County Public Schools, Virginia Tech, and the Virginia Health Department, and information on restaurant operations, including like hours of operations and how they're operating. As mentioned, we're basically making public aware of restaurant operations. We've created a resource for food services that are offering takeout, curbside, and delivery options. Basically, we asked businesses to fill out a form, and we post the information on our website. We've reached out to businesses directly to inform them of forms we've published and make them aware of information on social media. We've compiled a list of form responses from Chamber and also from DCI. Also, we continue to share the takeout over Montgomery County VA effort via social media. We've had Small Business Development Center collaboration, including a webinar with Amanda Forrester hosting that. The town pushed that out for businesses. We reached out to over 400 businesses directly to make them aware of that. Of course, we advertised it on social media. Amanda Forrester, the director there, spoke about economic development, disaster loans, and COVID-19 financial relief for small businesses. And she also answered questions on the webinar and from Facebook Live from people who turned in. That video is posted on our website at www.facebook.com/seaburgva.gov. And as I mentioned, as TAM allows, we've been reaching out individually to businesses via email, providing information on resources, direct them to the Small Business Development Center also for assistance. And just state that together we'll make it through this with the opportunity to build a stronger, more resilient economy on the other side. And welcome any questions if you may have them.
Well, were we able to unmute the mayor? Saw his name on here, but wasn't sure if we were able to connect him in through. Okay. Okay, well, Randy.
You're on mute, Kevin.
Unmute. Oh, well, thank you, Randy. Appreciate that. You guys have also done a remarkable job of keeping everything moving smoothly in the town. And it looks like the mayor is connecting with us now. All right.
I guess I am. I don't know.
We got you. All right.
Can you hear me now?
Yes, sir. We have you.
Well, I'd first of all like to echo everything that Randy said about the emergency task force. I would especially like to thank Dr. Bissell for all of her hard work and her guidance and leadership through this thing. It's a tough time for all of us. We understand that, but it's like we said, we're going to get through this thing. We keep our public safety.
Mayor, it sounds like it's cutting out.
Our public.
Are you still with us, Mayor? Okay.
Barely, yes.
There we go.
But yeah, I don't know where all my message got through, but it's, you know, we've got to continue to provide the needed services, police, fire, rescue, plus public works to our citizens, and we're going to do our best to continue to provide those things. And we'll take a deep breath when this thing is all over with and figure out how we can all recover.
No doubt.
Thanks.
Well, thank you for your leadership, and thank you for joining us this morning. Hopefully stick around a little bit longer and see if we have some chat questions that come through. Our next speaker is John Provo, and John is the director of the Office of Economic Development at Virginia Tech. And I'm sure John is keeping a close eye on the economy and businesses. So John, we'll turn the floor over to you.
Kevin, thank you so much. And I've got a little, sorry, there's a truck driving by. I've got a little bit of a different spin on things for folks to perhaps think about. My office at Virginia Tech is a part of the university's outreach division. So we do a lot of things with companies and communities around the state. I think the hat I'm asked to talk about today is our work with a program called Go Virginia. And some of you may have been at sessions before where myself or our regional council chair, Ray Smoot, have talked about this. But this is a state program designed to funnel money down to regions to plan and invest in growth in high growth industry sectors and build on the infrastructure to strengthen and diversify regional economies. And that's it's not a ton of money. We typically get maybe $1.5 million a year, and it's you know, so it's kind of it's a targeted. But what we're doing right now, working with Kevin's group, with the chambers, and others across the Newer Valley, across the Roanoke-Allegheny region and the Lynchburg region, that's our service footprint, is really trying to get a handle on things that they are hearing from businesses in our target sectors. And that includes healthcare, life sciences, that includes manufacturing, food and beverage, manufacturing as well, and also IT and emerging technologies. And we've got a little bit of money available right now. It's not enough to solve all the massive problems that are out there. But we think it would be very appropriate resources to invest with, and again, it can't go to individual businesses, so it's got to go through collective efforts of groups like Chambers, like Kevin's organization and others. But you know, we've talked to organizations already that are looking to help with transition to telework, for example, training needed or resources and infrastructure needed. We're talking to folks about when I think it was Marc mentioned, when the science explains to us how to safely go back to work in July, or even look ahead to the fall and be prepared for you know, designing safe workspaces for, you know, to protect us against any potential second wave of this. You know, now would be the time for us to put these Go Virginia funds to work, investing in initiatives and programs that will help us prepare and be ready to go back to work in the summer and sustain our work in the fall. We're going to have some changes in the program. You know, it's also a partnership, a co-investment really with local governments. I expect, and hopefully this will be good news to our partners on the line, our state board that governs this is going to meet next week. I think they're going to hopefully provide guidance on waivers for a local match that's typically required in this program. I also expect yeah, some additional guidance. There's some centrally held funds that they're probably going to release for us to use in the regions. specifically for responding to needs generated by the crisis in our target sectors in the kind of method that I've described. So, you know, I really think that's kind of at the core of the message that we've got from Go Virginia. I think there's a lot of critical focus right now placed on, say, putting out the fires that we're facing. And as you get a handle on that, I think what we can offer really is a resource to support planning for recovery, planning for resilience, and being ready into the summer and the fall. And Kevin, I'll leave it at that. We've all been on for a really long time, and I'm sure there are also lots of good questions for the whole group that have been building up.
Yeah, it's a good reminder for our chat group. And John, thank you for what you're doing with Go Virginia and championing some pivot points in there that'll help on the recovery aspect. I don't know if many of you all received the Virginia Business email that comes out every morning, and saw a good article in there this morning from the Richmond Fed and talking about what the nature of this recession might look like compared to other recessions. Hopefully it's a sharp V rather than a deep trough. Hopefully that's a positive forthcoming for a quick recovery, perhaps. So,
Kevin, I guess I would argue that I think one of the things to get us to that is, you know, listening to our public health folks and our scientists, and taking their guidance and advice into how we design or redesign our workspaces and our business models as we go back to work. And I think from, you know, the economy isn't magic. The economy is what everybody on this, you know, on this Zoom call does. And the collective action of all these individual businesses and governments and other partners is going to be a big piece of figuring out if that's a V or a trough.
right. Yeah. Great point. Reminder, you have the chat toolbar there. If you have any other questions for our speakers today, feel free to submit those in. On that chat bar, you'll probably be aware there's some good resource links on there for you. If you're interested in more information about being able to receive testing for COVID, the health district phone number for that is 540-267-8240. There's also some links on there for websites for more information locally. Okay. I'm not seeing any other questions come through at the moment. So we'll go ahead and wrap up our session, and thank you all for joining our community conversation. I also want to thank ServPro once again for being our sponsor, and also share with you that if you find yourself in that unfortunate situation where you have a positive case in your office or where you work, ServPro does have services available to help remediate that and clean and sanitize. So please reach out to John Tuttle if you have any need here in the near future. Just definitely want to thank everybody for participating, and thank our speakers, and you all be well and stay healthy. Take care.
Thank you, Kevin.
Thank you all. Have a great day.
Thanks, Josie. Thanks, Sharon.
Thank you.